Guys, I'm so excited to be here today with Dr. Sonali Lal of Integrative Spine and Sports. Dr. Lal is the amazing doctor who did the PRP in my ankle after I sat with a sprained ankle for months thinking about contacting her. And I have so many questions for her. I know you guys are athletes, or maybe you're just like everyday longevity seekers, but we're gonna dive into all the questions. Dr. Lal is based here in New York, and she is awesome. Thanks for dropping by and coming downtown out of your busy schedule.
Well, thank you so much for having me, Marni, and this is very exciting. So, yeah, I'm excited.
So, how did you get into sports medicine, and like what led you down the path to go into being a physiatrist?
So I was always fascinated by the world of physiatry. It's a very unknown, small field. Podiatry, psychiatry, no one really knows what it was. And physiatry is really focusing on the human body, really focusing on the anatomy. And the part of physiatry which I chose to focus on was sports medicine. And what I realized was 90% of most musculoskeletal injuries don't require surgery. But when we, hurt our elbow or hurt our back, we go straight to the orthopedic surgeon.
Right.
And what do orthopedic surgeons know how to do? I mean, for no fault of theirs, their focus is on cutting.
Right.
And so there's this huge gap between go to physical therapy and get on the table and about to do your surgery. And so that's really where physiatry comes in. It's like, what else can we do? Like, I'm sure we've all been frustrated and not progressing with PT at some point, right, but not really ready for surgery. And that's really where physiatry comes in.
And so where are you from? Where'd you grow up? Like, how did you go down the path of being a doctor?
Well, I mean, I was born in India. My parents moved here when I was 3 years old, and I was raised in the suburbs of Massachusetts and New Hampshire. And I think, like most immigrant families, especially Indian ones, they focus on doctor, engineer, or something along those lines. And I was the eldest daughter, so eldest daughter syndrome. And and I think I was inquisitive about it, but I really started developing my passion for it as I started working more and more. And I really do love it. I feel blessed that patients trust me with their care. I know it's no small feat. I myself have dealt with, taking care of my dad when he was sick, and just really seeing the other side of it. So I feel very honored.
And were your parents doctors as well?
No. My parents were... they were not doctors.
I got it. So
yeah. I was the first one.
And also, I remember when I was at your office, your sister works with you, which is so cool. I love my sisters. I have 2 younger sisters, and we're all best friends, but we don't work together.
Yeah.
Although my younger sister did work for me when she was like 16, and I had a PR company. I used to have her come into the city and help me stuff gift bags for events. My sister is like my best friend, and I feel blessed, and I always tell my sister she's the greatest gift my parents gave me. I'm sure it's frustrating working with me because I know I can be all over the place, but my sister is a sense of calm, and we're very close. She's a pharmacist. She works 8 blocks away from me, and so I feel very lucky to have. Very few of us kind of have our entire family in New York City, and I get to have that. That's awesome. What inspired you to start your own business?
Truthfully, I was working in a group practice. I was working at Columbia, and I had very strict hours. And during my maternity leave, I said I wanted to figure out how to control my time better. I wanted to be controlling of my own destiny, my own time. I wanted to be home more. And I thought, hey, maybe if I start my own business, that will happen. That is literally the exact opposite thing which happened. I started working a lot more, and I'm sure as any entrepreneur knows that when you start your own business, you're on 24/7. Yeah. But it was a good kind of busy. It was like building something and creating something, and from starting my office of 2 hours a week to slowly building our practice to now having 14 offices in the city was really an exciting
very hard journey, but very satisfying. And so, and I also like to think that I'm showing my son, like, a good example of what it means to follow your dreams, follow your passion. And it requires a lot of hard work, but at the end, you come home rested but satisfied.
And you're a role model for him, you're a role model, right, for him to, see his mom running a business and working every day. And how have you been growing your business? And I think this is a challenge of a lot of entrepreneurs, growing your business and also doing your actual job as a doctor, which is I feel like that could be such a big challenge for doctors.
At this point, I think the doctoring part is the easy part, right? I mean, I can inject a knee with my eyes closed, to be honest with you, but running the office, the front desk, someone calling out or being sick or, or attitudes or whatever it is. I mean, I think that's the hardest part. And, also not having shiny object syndrome, which I think a lot of entrepreneurs get, and you go to a conference and there's this new thing to learn and you can do this, you can grow this. It's really how do I stay focused and how do I practice good medicine while still being able to stay afloat and successful in a uber competitive environment like New York City.
And so talk to me a little bit about integrative spine and sports and the services that you offer at your practice.
And so this goes back into what do we do between PT and surgery, right? And so we wanted to create a center. I wanted to create a center where someone could come in and you'd really get good quality care from the beginning to end. So if we see you've hurt your back, we're going to set you up. We're going to first of all come up with a diagnosis, because so many times you just go to a place and they're like, oh, I've got back pain. But what kind of back pain? Is it a herniated disc? Is it spinal stenosis? Is it facet arthritis? Because once we know exactly what you have, then we can be laser focused on how to treat it. If you're just kind of broad spectrum, you're going to get broad spectrum answers. We really want laser focused diagnosis. And then from there, we set you up with really good hands-on physical therapy. It's all one-on-one, no big group setting, and really getting focused care. And then I speak and meet with the therapist every day on the care of how the patient's progressing. And if they're not progressing, they come in for any kind of injection, medication. And so it's really having a safe environment, be it for acupuncture, massage, physical therapy, chiropractic, stem cell procedures, PRP, whatever it is, from beginning to end, we kind of have it covered.
Okay, that's awesome. So, for a lot of listeners, I will say I'm going to a physiatrist. So let's demystify physiatry, because it's sports medicine, but it's also pain medicine. And I know that you do a little bit of both. We met through an athlete, but I'm sure that a big part of your practice is also doing the pain medicine. So maybe share with people, like, if you didn't just kind of cover that in what you just said, but like maybe just the more catchy question is like, what do you do as a physiatrist?
So I think number one, what I do is I come up with a diagnosis.
So you're almost like a diagnostician.
Really figuring out, like, so many times people will come in with back pain, but is it their back? Is it their hip? Is it their labrum? Is it their, facet? What is it? So coming up with a very laser focused diagnosis, I think, is my number one job. And then from there, putting the patient on the right path of, like, what is the right treatment plan? Just like most doctors, is like coming up with what is the right thing to do with the patient is my goal.
And then why are a lot of physiatrists not covered by health insurance? Like, what is that in my head, or is that real?
It's in New York City.
It's in New York City? Okay.
I think
I understand it's like
so expensive to just run a practice here, and I think a lot of times you're seeing patients that are out of network because, truthfully, I wish I had a better answer for this. If you probably go to Tennessee, you'll find a bunch of physiatrists that are covered under insurance. But here, I just think, just like any doctor, like my OB, my functional. Like no one is covered under
No one's
Medicare.
covered. No good doctors are. No, I shouldn't say that. I shouldn't.
It's I think it's just not. I think the word really is time, right? So if you are making, I mean, I hate to say this, but you're making $45 a visit,
right?
Then you're going to have to see a lot of patients in that 1 hour. So you're giving about 10 minutes to a patient, and it's just not fair to the doctor or the patient, the way just the health system is. And on top of that, add in how expensive it is to run a practice in New York.
Yeah, I always wondered how that
mind-boggling
kind of business worked for doctors.
Like right now, we're a dying breed, single practitioner. So forget about even most group practices are being bought out by private equity or by hospitals, right?
Right.
So there's, I think, like 3%? I'm not sure the exact statistic, but there's like 3% of single physicians and that own their own practices now, and even less women. So it's gotten out of control because it's so expensive to run a practice. Insurances make it so difficult.
Right.
So so now you're dealing with two things, especially in New York. You have these incredible costs of running a practice, the rent, the staff, and then you have decreasing insurance reimbursements. So it's a double whammy.
Wow, I've always wondered like the behind the scenes, especially in New York City. I mean, it's like everything is just like rent, everything.
Yeah, and then people get upset that why is the doctor not taking their insurance? And I think this is where it's like, well, doctors are supposed to have this altruistic, like, just come on in and we'll see you. That's fine, but guess what? Our landlord isn't going to let us.
Right, like you still have to pay
we
your
still
rent.
have to pay the staff.
No, but let's talk about PRP, because we just did PRP on my ankle, which I probably should have done months ago, but should have, would have, could have. What is PRP, even though I know? Yeah. But what is PRP? Break it down. How does it work? When do you do it as an athlete or as just a regular person? Like, when is it your go-to? All right, so I am now 7 weeks post PRP. You did the PRP process and injection in my ankle. So what is PRP? How does it work? And what is it used to treat for best practices?
Yeah. So PRP is platelet-rich plasma. It basically is a simple blood draw. We take your blood, spin it, concentrate it, take out the red blood cells, and then those platelets we then inject into damaged tissue. The platelets have growth factors. Those growth factors help heal tissue, help decrease the inflammation, and help repair basically the injury. We do it under ultrasound guidance because we want to be very specific. One thing about PRP is it really has to go to the right place. So we want to make sure that we're doing it very specifically. That's where we go back into, like, when someone comes in, we really need the proper diagnosis.
Right.
It goes back to...
I feel like I called you and I'm like, I need PRP. You're like, you need to come in and
and
get a consultation to make sure that it's going to work on you. I was like, oh, okay.
Yeah, and we don't do PRP on everyone. We really, it's about finding the right person. Any regenerative treatment is really, there is a buy-in here because it's not going to work immediately. There is, it takes anywhere from, 6 weeks to 6 months to get better. But what we are really doing is we're fixing the problem. We're not just putting a Band-Aid on it.
Right, and so it works for ankles, for knees, for tennis elbow.
Yeah, so I think the best way to kind of say what's PRP works best for, I'd like to say ligaments, tendons, soft tissue stuff.
Okay.
So whenever there's a ligament, a tendon tear, that's where PRP comes in.
And what's going on in your body that it's not healing?
So oftentimes, like after 6 months, the body stops recognizing something as foreign and it sort of just accepts it. Like immunoglobulins stop, like releasing their stuff, and the body's like, okay, well, this is just a part of who I am. And what PRP really does is it wakes that body up and says, hey, this is not normal. And it causes a trauma and a trauma response, right? Because it's almost like we're reintroducing an injury. So if you have a tendon that's torn in your elbow,
right,
and you've been suffering with it for 6 months, now we come in with PRP and we first go in with a needle and we will create a little bit of inflammation, and then we supercharge that area with those growth factors and healing factors.
Got it.
And think of it like this. We're introducing an army of healing factors, or an army of soldiers that are there to heal your injury. But what that army does is it also reintroduces the injury and wakes up your body and says, hey, we need help.
Right.
So if you have 1 million soldiers going to your elbow, it's going to wake up 10 more million inside your body, and that's real. And then that's how we get the healing response.
And so it usually takes like 2 or 3 times.
Usually, I mean, I think more and more,
there's more science behind
There's
that.
more science behind it. I think for the last 20 years, people have just sort of been trying to figure it out.
Yeah.
And I think now it's really ideally 2 to 3 treatments, 2 weeks apart.
And why does it take so long for an ankle to heal, do you think?
Oh, because it's really the hardest. We don't give it rest, right? So if you, we can't wait to get back on. The first question you asked me was, when can I start walking?
Right.
And so, but if it was your elbow, you would have been fine with it. Or if it was your shoulder, you would have been like, okay, fine, no big deal. So we never give our feet enough time to heal. I myself I fractured my foot when I was 22, and instead of 6 weeks, it took me 18 weeks.
Yeah.
Because I never was compliant.
Yeah. I guess that's kind of my journey too, right? Like I sprained my ankle in August, and then I ran 14 miles on a sprained ankle, and then I stopped, and then I started running again because I decided that it was time for my ankle to be healed, but it wasn't healed.
Yeah.
I ran 6 weeks, and then I was like, I think I should explore this PRP thing, because it was already like December, and I've actually like never had any kind of injury, so it's like definitely alarming. But I feel like now, like definitely, I feel like it helped, even though I only did 1 injection, like not 1 injection, but like 1 session.
Yeah, we need to get you back in the office.
So I just like, I feel like, that it was good. I'm coming back to the office to do an ultrasound and see what's what. But yeah, I mean, I feel like if I need to do more, I would just do it all like in a 2-week period. And just, because I feel like it's like the ankle, it's just so hard to be injured. Like it's crazy. And especially, I don't know, but I know you see a lot of athletes, so you're used to this kind of like mental thing.
Yeah.
And what about, stem cell therapy? Like, how does that work?
So,
Since we're on the path of regenerative medicine and healing.
Yeah, so stem cell therapy is basically, it's exactly what it is. It's taking your stem cells out from your iliac crest or from your back. It's something that's done in the office. We numb the area, and we take the stem cells out. Yeah.
No, it's painful.
There is a, like, doctors don't use the word painful.
Oh, okay, I won't say that.
Uncomfortable. But yes, we give Nitronox or laughing gas, and then we numb the area. And so there is definitely like probably about 10 minutes of discomfort on taking it out. But what you're really getting is real stem cells, and these stem cells they're fresh, they're your own. So truthfully, the healthier you are, the better the results are going to be. And that's where patient selection comes in. Mm-hmm. And then we concentrate them and then inject them into the injured body part.
So where do you usually, how do you decide between PRP or stem cell therapy? What is best for what practices?
Yeah, so for ligaments and tendons, usually I like to go more to PRP, mm-hmm. IT band, small tears, elbows, PRP, foot injuries. And then if it's more like arthritis or cartilage or bone related stuff like knee arthritis, hip labral tear, shoulder tears, that's usually where I go more for the bone marrow. I often tell people it's almost like 3 PRPs is equivalent to 1 bone marrow, and that's just completely out of my own head, but
I love it.
But I
it's
think
like PRP on speed.
Yeah, it really is. And Yeah, and we get really, really good results with the bone marrow. I wish there was a way I could just painlessly extract that bone marrow
Right.
and so I could just, I think people often get scared because of the extraction of the bone marrow, but really it's not that big of a deal.
Yeah.
And the results are phenomenal.
Yeah. And so do you have a lot of athletes coming in, or is it more like longevity, like everyday people for the stem cell?
So I think we see a lot of, being on the Upper West Side, we work very closely with the New York City Ballet.
Right.
See a lot of ballet, a lot of Broadway,
Mm-hmm.
a lot of dancers. And then we have a lot of people that are just everyday weekend warriors that are
Yeah.
coming in and, have just sort of tried everything and now don't want to get surgery.
Right.
And those are usually our biggest clients.
And so, since we're talking about injuries and athletes and injections, what is cortisone, and why do people think like, oh, you should get a cortisone injection?
Yeah, I mean, listen, traditionally, like during my residency, this is all we've been trained, right? In hospitals, that's what they do. Like cortisone is still what's injected in the hospital, and there is a role for it. So if someone comes in, think of it as like if there's a house on fire. If there's a house on fire and there's fire everywhere, you're gonna throw water at it. And that is what we do for cortisone. Like, someone comes in, they can't walk, they can't sit, they're can't sleep. We're going to give them a cortisone shot because we want to calm this down. And then later we'll introduce the PRP. But what happens is, going back to that house analogy, is like every time if your house is on fire and you're throwing water at it, eventually that wood in your house is going to get waterlogged.
Right.
And that's really what cortisone does. Is repeated cortisone injections will damage tissue, will tear ligaments, and will weaken. And there's proof of this, pathological, it's all proven. So repeated injections, and even to the point that on cadavers, when they've done, postmortems, they've seen that they can actually see those small cortisone crystals still there decades later.
Yeah.
So
I feel like they give you like a minimum of, you're allowed to get 3 cortisone injections a year or something, like physically.
Per location is.
Oh.
Yeah.
So it's basically like a Band-Aid.
It is a Band-Aid. It's
Okay.
yeah.
So what is frozen shoulder in the best way you could describe it, right, as a doctor, and how do you treat it? Yeah.
Yeah, so the exact pathophysiology or what causes frozen shoulder is actually, believe it or not, unknown. But what their biggest hypothesis is that there's inflammation around the synovial fluid, or the fluid in the joint, which then causes these tight bands to get stuck together.
Got it.
And it severely limits the range of motion. Most commonly we see frozen shoulder happening after an injury. Patients are, for whatever reason, they injure themselves. Like it happened with my own dad. He injured himself, doesn't believe in doctors, and even though both his kids are doctors, and decided he'll take the sling off whenever he wants, and kept it on too long, and lo and behold, it took him 2 years to fix that frozen shoulder. And frozen shoulder is hard to fix because what happens is that the bands get very, very tight, and you really have to do extensive physical therapy or is or some people even go under something called manipulation under anesthesia, which is under general anesthesia, to break those bands.
Wow.
Most commonly, frozen shoulder is seen either after an injury. I know during COVID, people were saying
that they got it from the injection.
Yeah, but it really wasn't the injection. It's really because they may have had pain after the injection, which made them not want to move their shoulder, and that likely is what caused it.
Got it.
It's very commonly seen in diabetics because of the mucopolysaccharides, or the sugar in the ligaments and tendons. It has a tendency to stick more. Commonly seen in thyroid disorders, and also commonly seen in perimenopause and menopause.
just random,
Yeah.
like nobody knows, right?
So
I
with-
did hear a lot of women who are in perimenopause and menopause talking about it separately and apart from the injection.
And
people.
it's only been correlated, I would honestly say, probably in the last 10 years, just because of so much, like emphasis and spotlight being put on this. I'm
Right.
sure before that they were just telling the woman to,
She's
"It's
fine.
Get out of here.
You're
go to
normal.
PT." Yeah,
We're
exactly.
like for our entire lives, we're told we're normal
We're
based
normal.
on like the studies from like men
Men.
100 years ago.
Yeah, exactly.
There's such crazy science happening now. It's amazing, like in the world of menopause, and like just health in general. So it's I look forward to the next 10 years. I hope it's not too late.
Yeah, I love it, and I mean, I'm going into deep dives. I myself am, I'm at 48, and so it's very
Yeah.
interesting to see learning all this, because otherwise I think our moms probably just kind of dealt with it
Yeah.
and didn't really know, and just sort of, we're busy
Yeah.
raising kids or taking care of
Yeah.
other people, and now we can actually say, oh, okay, this makes sense. Like,
Well,
I'm not crazy.
No, and I think like as a doctor, I'm curious to hear like if you don't mind sharing
No,
like
no, of
what your plans are with like when you do go through menopause, like
Oh.
if you're gonna take medicine or what. I'm this like a little older than you. I'm 53,
Mm-hmm.
and I did absolutely nothing because when I was growing up, I was told that it was normal to like have no progesterone and no testosterone and especially as an athlete when I was younger, I started like 38, 40.
Yeah.
I started doing triathlon and in a big way. So I just stopped getting my period
Yeah.
by 44 and like never took anything. I didn't really have a lot of hot flashes or any issues, but I just raw dogged it.
Yeah, no, I'm
And now
definitely
I'm
not
like,
raw
shit.
dogging it. I am. I'm one of those people that are like, give me everything, please. And so I am. I mean, honestly, I'm currently. I just started it. It's not even been a month, but I'm currently on testosterone therapy. I take this cream and put it behind my knee
Yeah,
every morning.
we need testosterone, especially for our muscles and our bones and our health.
Yeah, and other stuff too,
Yes,
right? Yeah,
that's true.
And so
Yeah.
I was, and I think it all happened in the last 6 months where I was kind of like, oh crap, what the hell's going on? And is it work stress? Is it having a teenager? What the hell is this? And then
Right.
I went and I got my labs tracked, and I went to my OB and went to my endocrinologist, and I said, hey, listen, I really want to figure this out. And I actually started on progesterone therapy. I'm not currently on estrogen. They said I don't need it right now.
Right.
But when the time comes, I will have no problem slapping that
Right.
on.
Because you have to think about your cognitive health, not just like your hormones and your organs functioning, but also like your brain.
Yeah,
And-
brain and heart, and being South Asian, they're already at a much higher increased risk of cardiovascular disease. So, I want to be. Estrogen is also going to be cardioprotective. Progesterone is great for your mood, to help you sleep, because what happens to me is I'm like wired and tired, and so
Right.
like I come back tired after a day of work, and then I can't sleep.
Right.
So
I'm the
it-
same.
Yeah, so it's and I think for testosterone, it's just really important because you go to the gym, you work out, and if you don't have like this baseline testosterone, then you're not going to build that muscle. And
Right.
muscle goes back to longevity, because if you don't have muscle as you're getting older, it's going to increase the risk of poor balance,
Right.
falling, and I'm sure we all know the studies of like women that fall, break a hip.
Right.
Half of them don't make it within a year.
Right. So now, do you think that this is something that you might do a deeper dive into in your practice and bring in? I know this isn't your
Yeah.
background, but you are a doctor, right? So,
Yeah.
I mean, obviously, you'd have to take some courses. And are you
Yeah,
thinking
no,
about
so
that?
I'm currently a part of this amazing group of doctors. It's about 20 to 25 of them, longevity doctors in New York City. We meet monthly and have a weekly meeting where just really there's so much noise out there. And
Yeah.
it's like, what is noise and what is real? And so, for me, I will never bring anything into my practice that I can't do on myself or my family.
Right.
And so it's really is, so I'm currently, learning more and more about this and figuring out, like this Saturday, I'm going to a hormone and longevity conference because that's what I do on Saturdays.
Where? I want to go.
Come, it's downtown, and and it's a very small, intimate group of doctors that are really getting together with real data and sitting down and saying, okay, fine, this is what makes sense. And they're all practicing doctors, so
Right.
there's it's really like, okay, what can we carefully and safely bring into our practice that
Right.
we have some data.
That's amazing, because I think, like, we've got the right women at the forefront of the discovery and pioneering what is working and what's not working, and digging deeper. Now that we have all these, like, women that have come up through the workforce, through medical school, and are, like, taking the initiative, like Mary Claire Haver, or there's another woman, Dr. Lisa Mosconi. But I just feel like it's like a category, like menopause is a category of medicine that has so much to do with, like, endocrinology and hormones, that people just thought it was like this small thing, but actually it's like what you're saying, longevity.
Yeah, and the thing is, we have never been taught about it. It's just kind of like the whole nutrition thing, right?
Yeah.
In medical school, we're never taught about nutrition, and we're really never taught about menopause. Maybe like, I don't know, paragraph or two, and
Yeah.
it's and that's it, right? And so,
And you're like, yeah,
and now we're going through it, and it's just, I'm so blessed to be at a time where it's being brought into the spotlight.
Right.
So, and it's interesting because I'm going through it myself, so it's like I want to learn more and more.
right.
I'm
I
like a
think that's how
sponge.
it happens, though.
Yeah.
It's like when women who are doctors are going through this process and won't take no for an answer, and so
Yeah.
those are the people that are helping bring this to light, like Naomi Watts, also, like, not a doctor, but like just spending a lot of money
Yeah.
bringing it
They have
out
great
there.
stuff at the Swell that
Yeah.
when they have these conferences, and it's
Yeah,
wonderful.
I haven't been to any, but I heard about it. So, we're talking about menopause, and we're talking about women. So I want to talk about GLP-1 and peptides, because this is another area of, like, sports medicine and what you do that I think is so fascinating, especially GLP-1. Recently I was listening to someone that I listened to on the podcast talk about how if you're taking GLP-1, the first thing that happens is you start to lose muscle. Who should be taking GLP-1? Obviously, this has been around for a long time, and everybody has different thoughts on it. But what are your thoughts on GLP-1?
So my thoughts are, I'm for it. I think that, there's if done intelligently and properly, there's no harm in it, right? I mean, I think there's so much stigma, like, oh, are you taking a shortcut? But who cares? Like,
Right.
as long as you're getting to the end goal, it's this is what we want, right? So yes, like, is there data supporting that you will get muscle mass or muscle
Bone
mass?
density,
Yeah,
yeah.
so then let's be smart about it. Let's do it let's make sure that we're getting our 1 gram of protein per kilogram every day when we're on this. Let's make sure that we're lifting heavy weights, and and then take it, because if you can lose that weight
Right.
and maintain your muscle mass, and there's studies that are saying that it helps you, now there's like studies saying it helps you cognitively with, like, Alzheimer's, cardiac, addiction, then what's the harm?
And GLP-1 is a peptide.
It is a peptide.
Okay.
It is a peptide,
And what is that category of medicine, peptides?
It's a brand new category. It's like a new one coming up every day, and it's basically it's an amino acid.
Okay.
And so that's and it's injected once a week, and I started using GLP-1s in my practice because I would have patients that had knee pain. So if you open our, books in school, the first thing they say is if someone has knee arthritis or knee pain, tell them to lose weight.
Right.
So, oftentimes we don't say that to the patient, or we'll say it and, the patient will get offended, or like, they're like, well, if I could have lose weight, I would have lost it, right? Or they're trying, but they're in knee pain, so they can't work out because their knee hurts. So then I thought it was fantastic, because now we have these patients, like 1 pound on their stomach is 16 pounds on their knee.
Right.
So if we can take 10 pounds off of their stomach, and that's 160 pounds of pressure taken
Right.
off the knee. So automatically that patient is now feeling better. And then you can say, hey, go strengthen your muscles. And then it makes a little bit more sense. So
Yeah.
what you're doing is you're really equipping, and the same thing with back pain, like, your core controls 80% of your back. So if you have a huge gut coming out, there's no real control, and then there's instability of
Right.
your back.
Right.
So I mean, I think it all ties together. So that's kind of how I started it in my practice. I was very hesitant to, but I did. Started getting really great results, and now we use it. And now there's even talk about it in longevity. Like, do you microdose? Do you not microdose? And I think the verdict is still out in that.
Like microdosing GLP-1?
Yeah.
Yeah. And what are some of the other peptides that people should look to take? And also talk to me about how you take peptides, because you can't just like put them in a smoothie.
No. So peptides, yeah. So, a peptide that we use a lot in our practice is BPC 157. Now, so the problem with peptides is that they're very highly regulated, right?
Right.
Because one day they're on the market, the next day they're off the market, and then the following day they're back on. So just figuring that out is a full-time job itself. But
Right.
we do a lot of BPC 157, and it comes in oral and injectable. Obviously, the injectable is superior. And when
And you have to inject it into your stomach.
yeah, that's the annoying part. It's like 5 out of 7 days you need to inject it, and that starts taking. I started taking it, and then I kind of gave up because I was like getting black and blue all over my stomach.
God. Yeah.
But I think the people that it works very well, and it helps heal ligaments and tendons, and I mean maybe.
Yeah, maybe
get
I
it
should
for
be
you.
doing
Yeah.
that. Yeah.
So
I don't know. Yeah.
Yeah, it's I mean it's a good peptide. It's like solid. It's been there a long time.
What are some of the other peptides besides GLP-1 that you see people asking for or using, or that you've heard of maybe?
Yeah, so a lot in my practice, we do a lot of BPC 157. It's used for, injuries, tendon, ligaments, collagen production. So that's one of them. The other one is thymosin beta 4, and the last one is CJC 1295, which is an analog or similar to GnRH or a growth hormone analog. So growth hormone for everyday life is illegal to use that. So it's really just for patients that have pituitary diseases. So it's impossible to get. So this is like you could say the little cheat sheet to that and shortcut to that, and it's similar to mimics growth hormone. And growth hormone, helps us Benjamin Button ourselves.
Oh, okay.
Yeah.
Interesting.
It's great, but like
it has to be monitored.
It has to be monitored.
And it's not really legal. So
no, it's not legal. It has to be monitored, and heaven forbid for those all out there that are thinking they're going to go jump on the growth hormone wagon. Let's say you have a small occult precancerous lesion or something. Take the growth hormone, and heaven forbid it can create something that wouldn't have otherwise been there.
Interesting.
So it's it's a double-edged sword. It's not worth it.
Yeah, but that's just like you're just giving me like the spectrum of what's out there, like buzzing in culture.
Yeah, I mean, I think the safest and whenever you can get it is the peptides. I think like I said, the BPC 157, the thymosin beta 4, and the CJC 1295. I mean, there's hundreds of them out there, but those are probably the top 3 most commonly used.
Who typically used these peptides? Like, where does this come from all of a sudden, this like new category?
Yeah, I mean, I think they come from pharmacy. They're amino acids, and they're used usually by people that are really into the biohacking, looking for other answers, and in the longevity world. And it's one of those things that is being brought into light more because I think the benefits are. Where people are seeing the benefits, and it helps. And it goes back into what can we use so that we don't have to suffer with an injury,
right?
Yet we can don't have to get on the table and get surgery. So
Right.
it really falls back into that world.
And in your practice, I mean, would you say like what % of your practice is just everyday longevity seekers versus like triathletes and runners?
So I think usually it's patients that are coming in are usually coming in with an injury,
Yeah.
right? And it's almost like it's a part 2 right now of the practice. So if they're coming in with, like, example yourself, you come in, you have your injury, and then we're going to talk about, well, how do we prevent this from happening again? And
Right.
what are some things that we could do? So, like, do we do a series of PRP? Do we start doing some BPC 157?
Right.
And later, do we then talk about, the other peptides of CJC 1295, which can help with blood flow and healing of your tissues. So,
Okay.
yeah.
And now you yourself are athletic and play tennis.
Yes.
That I know. How did you get into that? And do you find time to play? Where do you play? Like, that's your sport?
Yeah, I mean, I think started in high school, and it's hard to maintain it when you're in college. And then after that, now I think since COVID, we went to Florida for a bit and really fell in love with it again and had time for it again.
Right.
And my son fell in love with it. And so we either play, luckily our building has an indoor tennis court. We either play there, or we play at John Jay, or we play at Riverside Park,
Yeah.
or Central Park. But
Awesome.
I love it. And now we're really into pickleball, just like the rest of the world.
Oh my God. I've not gotten into it. But as a tennis player, like, it's a totally different sport. Like, it's just a ball and a racket though.
Yeah. Yeah, I mean, I think for me, it's like just being a mom of a teenager, it's like I'm going to grasp onto anything that, my son will let me hang out with him for a little bit. So right now it's, he's into, building his body.
Yeah.
And so I'm in the background just kind of like hanging out. But
That's cool.
so tennis is the one thing he'll play with his mom. So,
That's cool.
yeah.
And now, are you doing like any fitness classes? Like, what's your personal like fitness and wellness that you do?
Yeah, so I have a personal trainer. I work out with them 3 times a week, and I really am trying to now, like, going back into the whole like perimenopause, bone density thing, is I am really trying to like lift heavier weights, and
Right.
that's not something I'm used to doing.
Right.
And so that's where my trainer is pushing me to try to make sure that we're lifting heavy, dense weights, and really like trying to do like 4 sets of 4, and like the last set should almost be impossible to do.
Yeah. Are there any supplements that you like to take as you're, like you mentioned protein, you're in perimenopause, like what are you doing? Like,
Yeah, so so one of this, one thing I would urge everyone, just like easy stuff, like just let's get the easy stuff right? Like, so vitamin D, just
Yeah.
like really simple. We're all vitamin D deficient, and there's so much data supporting, like, low vitamin D increases the risk of breast cancer by like, God knows how much percent, and just get the vitamin D in,
Yeah.
take it properly, get your vitamin D levels checked. That's one thing. Another thing, if you have access to it, just like a lazy man's guide to longevity, is try to get some sauna in. There's so much data supporting it. I didn't even believe it at the beginning. I was just like, how can this even be possible?
Yeah.
But like 40% overall mortality risk. Huge article came out in the JAMA magazine, and so like, I mean, you do have to do it every day, literally, and so it really has to be a part of your lifestyle. But so I'm just trying to get some sauna in, trying to do some creatine to help with my muscles.
I take that every day. Creatine, protein.
Yeah.
All of that stuff.
It's, I think for me, being mostly, pescatarian, it's hard to get a lot of the protein in. So my protein powder, my creatine. I also started taking magnesium at night just for my muscles and to help me unwind. And
Awesome. Well, this has been super cool. Thanks for coming down to
thanks for
the
having
studio.
me. Oh, this has been great. Thank you.
Thank you.